President, I want to start by thanking my colleague, Senator Hagan from North Carolina, for convening this important session this morning where we will talk about the urgent need to reform health care in our country. The unsustainable growth in health care costs and lack of stable, affordable coverage for millions of Americans continues to jeopardize not only our nation's fiscal well-being, but also the physical well-being of our families and neighbors. Mr. President, one of the key ways we can help put our health care system and our economy on the right track is by encouraging value in the delivery of health care. I've cited these numbers before. I know many of us have, but I want to emphasize them again. As a nation, we spend over $2 trillion per year on health care. That's nearly 1/5 of our economy. Yet between 30 and 50% of these dollars are not contributing to better patient health. That's not a good deal for the American people, Mr. President. Health reform is designed to address this staggering amount of waste in a number of ways. One way is to encourage providers to focus on the quality of care they provide and not just on volume. And we can start with Medicare, Mr. President. I think the American people would agree that taxpayer dollars are better spent by rewarding doctors for keeping patients healthy and not for performing more tests or more procedures. Health reform legislation can move us in this direction through the development of what are known as accountable care organizations, or ACOs. These organizations would encourage groups of healthcare professionals to team up and provide more coordinated, streamlined care to Medicare patients. The idea is to have these ACOs take responsibility for improving patient care while lowering costs and then sharing the savings that accrue. Now, research indicates that this idea of shared savings would help eliminate waste and spur changes in our healthcare delivery system to emphasize patient outcomes and value. Now, the idea for ACOs no doubt came from the great work being done by a patchwork of physician groups. Groups like the Physicians Health Partners, or PHP, in my home state of Colorado, and all across the country are focused on care coordination and quality. For example, PHP has seen great success in improving care for kids suffering from asthma, the #1 cause of child hospitalization and school absence. They developed treatment guidelines and promoted collaboration among doctors, the Children's Hospital in Denver, and the Colorado Allergy and Asthma Centers. As a result, they've reduced emergency room visits and improved families' ability to manage asthma on their own. PHP also has the Practice Health Project. This comprehensive effort brings doctors together to share best practices and encourage the adoption of common sense guidelines to improve quality and efficiency. The goal of this team effort is to raise the standard and value of care and allow these physician groups to act as a model for Denver's physician community as a whole. I'd also like to tout the PHP's Transitions of Care program. In collaboration with Denver's St. Anthony Hospital and other local care providers, the program dispatches nurse coaches to help Medicare patients make the transition from the hospital to their homes. The period immediately following a hospital stay is a very confusing time, particularly for our seniors. Having someone help with this transition is crucial. PHP has had tremendous early success with this program, showing the potential to reduce costly hospital readmissions by 40 to 50%. At the same time, this program keeps patients healthy and it saves money. The successes of groups like Physicians Health Partners demonstrate that we already have the will and the know-how to change our system for the better. But, Mr. President, under our existing system, there's no incentive for programs like PHP to even exist. Under the status quo, a hospital stands to lose money if it decreases its admission rates. Primary care doctors would be at a financial disadvantage if they spent time to develop and implement effective treatment plans for their asthmatic patients. This is why health reform includes common sense proposals, such as encouraging groups like Physicians Health Partners to form accountable care organizations and paying them to coordinate care for Medicare patients. Promoting ACOs and other creative pro-consumer ideas will increase quality for patients and value for the taxpayer. Only by reshaping the way we do business in our healthcare system can we truly change healthcare delivery in our country. Mr. President, I look forward to working with my colleagues here today and other senators in coming weeks to promote the many ways we can accomplish that goal. I thank Senator Hagan. I yield the floor.